Okay, it looks like it is straight up 12 o'clock, so we are going to go ahead and get started. Today, we're going to continue talking about the role of the infection preventionist. My name is Kara, and I'm one of the quality improvement facilitators here at Telegen. Next slide. If you are new here or you haven't already done so, you can scan the QR code that's here on the screen and register for some of our upcoming sessions that are every Tuesday and Thursday, 11 a.m. Mountain Time and 12 p.m. Central Time. Next slide. If you're on social media, you can find us on Facebook and LinkedIn, and be sure to add Telegen to one of your trusted lists of contacts here on the screen. Next slide. So we're going to be using Menti today for a couple of our questions and polling. So you can either scan the QR code and keep your phone out and ready, or you can log into Menti and enter the code on the screen. All of the answers are anonymous, so don't be shy when it comes to answering our questions today. I'm going to give you just a second or so to scan that QR code or to log in and enter that code that's there. Okay, next slide. So let's get started with the role of the infection preventionist, part 2. Next slide, please. Our objectives for today is we're going to discuss organization of infection control and prevention, identify weekly and monthly duty strategies, and describe the importance of communication as an IP. Next slide. This is part 2 of our Nursing Home Quality Essentials, A Day in the Life. And in our part 1 series, we took a deep dive into what a typical day could look like. Some of the topics discussed are listed here for you on the slide, and I'm just going to go through them briefly before we move on. So we reviewed the role of the infection preventionist by definition. We also looked into some of those F tags that are related to infection control. We looked at and reviewed the Telegen's IP orientation checklist. We also went over the importance of having an essential contact list as in your role as the IP. And we also looked at what a day could look like and the tasks for the morning upon arriving, from checking emails to rounding, morning meetings, and organization. We also talked about time for training of the new staff, your immunization program, and also additional infection control tasks to be aware of and consider. So now in this session, we're going to continue our discussion about organizing your time, tasks, and also going beyond each day and looking at the bigger picture of prevention and what those daily tasks mean for the week and for the month and for your overall infection control program. Next slide. If you didn't get the opportunity to join us for our part 1 of the role of the IP, that's okay. I have provided the links in the slides here for you, and the slides and the recordings can also be found on our Telegen QI Connect website in our resource library, and that link is in the bottom of this slide for you as well. Next slide. So prioritize and organize prevention. What do I mean by that? Well, I mean that you're not organized anymore. And if an emergency comes up, it means you are no longer in prevention mode. It's now all about control. And once we are in control mode, it seems to snowball and you no longer have time for prevention measures or implementation. We always hear infection prevention and control. I'd like to focus a little bit more on that prevention piece as your role as the IP. And I want to define prevention maybe in another way. Basically, prevention is what keeps you from chasing your tail and having to be reactive to situations as opposed to being proactive. And in order to implement prevention strategies, you need to be organized in your role. So prevention should be a part and be included in everything that you do. And being organized is crucial to being able to focus on those prevention strategies and implementing them continuously. I want you to get your minds thinking prevention a little bit. So I think we can all agree that we use prevention in our everyday lives to help keep ourselves healthy, right? So I want you to think about some of the preventative things that you do in your daily life to stay healthy. And so I'm going to ask you, you can either come off of mute, or if you don't feel comfortable, find that chat button again. And I want you to enter into chat something that you do to prevent illness and to stay healthy in your everyday life. I'll go first. I take vitamins. I take every day to try to help me stay healthy as a preventative measure. And what I do to make sure that I take those vitamins every day is I set them right next to my toothbrush and toothpaste in the bathroom just so I don't forget them. So tell me some of the things that you do preventatively to stay healthy. And Rose's going to let me know if she sees anything in chat.
Carol, we have wash hands a lot.
Oh, that's a good one. Good one.
And brush my teeth. Vitamins, drink emergency, frequent hand washing, drink plenty of water. I get plenty of
Nice.
rest. Yes.
Oh, that's a good one. A lot of us in your role, you don't get a lot of that. Very, very important. So I asked that question because just as we do things for ourselves at home to stay healthy and prevent illness, we should make it a priority to do the same thing for our residents in our facilities that we're caring for. So we know that prevention in your role is key. And in our last session, we talked about those infection control logs, surveillance being ongoing and kept current, and keeping that education and training up, doing daily rounds and anticipate what could go wrong and put things in place to prevent them from happening in the first place. Just like COVID, your COVID and your emergency preparedness for COVID should be thorough, meticulous, and methodically planned out ahead of time. And if you do have an outbreak, you should have your plan ready to be implemented immediately. And this is what's going to help prevent a widespread outbreak of COVID. Next slide, please. Part of the infection control prevention is identifying those residents who are at risk before they get sick and possibly sent out. So right now, if you think about it, are you currently prioritizing and identifying those residents who are at risk? If not, I strongly challenge you to look into developing an at-risk program, processes, and even using risk assessments to help you with that. These risk processes can be included in your everyday work, add it to that every weekly, and also quarterly, doing reviews on them. It should be a part of your work every day, is that prevention piece of identifying risks. And I want you to also think about maybe a resident, all newly admitted residents, going through their chart and identifying if they are at risk for infection based on comorbidities or previous infections. What I have here on the slide is not a complete list, but they're just examples of areas that you can look into to develop an at-risk program and processes. So these would be residents who are admitted with, or they've had a change in condition and they result in maybe now having a Foley catheter. Maybe you have a resident who's been in your facility for a couple years and now they are having issues and they have urinary retention and they have a Foley catheter. Well, now their risk for infection has increased because of that catheter. Identifying those that maybe were admitted with a wound or they develop a wound, they are at high risk for infection. Those residents who are diabetics, maybe a resident was admitted on an antibiotic or they have a history of infection. You know that they're going to be at greater risk and they need to be identified as well. All of those residents that leave your facility, maybe go out to dialysis, those that are immunocompromised, if you have trachs or you have ventilator units in your facility, those at risk for aspiration, they're also going to be at risk. So really taking a deep dive into your current program, and if you don't have one, really looking at implementing them. And like I said, these are just some examples of areas that you can look into that you should look for in those risk factors. Next slide, please. So here's our first Menti question. So be sure you have your phone out and you're still logged into Menti. Again, all answers are going to be anonymous here, so no one's going to know what you answered. I kind of want to know, are you required to generate any weekly or monthly reports related to infection control? So go ahead, put your answers in. You have either weekly, monthly, or both. And as you're doing that, some of you may not be required to submit reports, but maybe after today's session, you can look at implementing some monthly reports. Maybe you can talk to your leadership. Maybe you can ask them if there's anything that they would like, and you can start generating them to help you have a successful infection prevention and prevention program. I can see here we've got some that say, quite a few do monthly, some say both, some say weekly. That's great. I'm glad to see that some of you are doing these reports. So our next Menti question, next slide, please. So our next Menti question is kind of a follow-up. So if you answered that you do generate reports, either weekly, monthly, or both, if you could type into Menti, just kind of free type, at least one example of the type of reports that you generate. What reports are they that you are doing? And I encourage you to really put answers in there because, we have a lot of IPs on our call and maybe they're new, and maybe sharing with them the types of reports that you all are creating can help them move forward in their role. So if you can just put into Menti, you want to share some examples. So I see UTI, vaccination, falls, skin issues. Those are all great. Anyone else have any reports or want to put in any examples? Order listing report, antibiotics ordered for the month with diagnosis. That's great. Outstanding. You must have PCC. The type of infection reported, what unit they're on, vaccination status. Great. Thank you guys so much for entering some of those. Oh, I see some more popping up. Just continue to put those in as I move on. All facilities are different, and what you report and how often may look a little bit different. But even if you're not required to submit weekly or monthly reports, it is still part of your role as the infection preventionist to determine your infection control rates. For example, the rates of those with UTIs, both catheter and non-catheter associated, wounds with infection, sepsis rates, COVID. All of these should be some things that you consider reporting on. And this is how you're going to know if you need improvement or if even a system that you have put in place is working or not. Next slide, please. During our last session, we talked about possible daily duties, but let's look at some possible weekly duties to ensure that you're staying on task with prevention and staying organized with everything you do as an IP. So some questions are, do you have a weekly antibiotic stewardship meeting? Do you look at who all is on an antibiotic, why they're on it, how long have they been on it? Do you do a weekly at-risk meeting? Some facilities call them a PAR meeting, a patient at risk meeting. I challenge you to look into your reports if you do them, and also look into weekly meetings, and also to take a deeper dive and look in depth at the infection control piece that you're actually reporting on. Are you just totaling how many infections you had? Like, oh, we had 15 infections for the month. But are you breaking it down? Are you identifying how many were admitted with? How many were on antibiotic and are related to sepsis? How many are GI related? I'm going to encourage you, if you're not doing that, to take a closer look at your antibiotic log, look at your surveillance to ensure that you are going beyond just totaling those infections for the month. Look at the previous month. If your infection control rate is at 9% this month, and last month it was only at 6%, you should be looking into that. You can do a root cause analysis. You can do a PIP. You could try to improve your infection control rate. Take a look at some of those and take a deeper dive into those logs and those surveillance that you're doing each and every day. And I encourage you to do it weekly to take a look at where you are. Next slide, please. So all the prevention efforts, interventions, surveillance that you do on a daily and weekly basis brings you to your end of month reporting. This includes any and all reports that your admin, DON requests, and what's required for your corporation, for your monthly meetings, quarterly meetings, QAPI meetings. The goal is to use all of these logs, your surveillance, and the data that's collected to identify areas of improvement, looking at adverse events that could have been antibiotic or infection control related. Maybe there's upticks in certain infections in areas where education could take place. Some additional monthly considerations I have here above on the slide. So take a look at podiatry and your dental services. If they come into your building, do you ever observe their infection control practices while they're in your building? Do you ever speak with podiatry after to discuss the antibiotics that you all know, as well as I do, that they put these residents on after they've provided foot care to them? Consider doing skills checks for some of your specialty equipment that you may not look at on a regular basis. Like if you have vents or you take trachs, let's take a look at some of that, do some skills checks. What about your CPAPs? How often do you do skill checks for those? Looking for proper preparation and the use of it. And then the cleaning of the CPAP machines and even your nebulizers that are being used. If you review your antibiotic log or your hand hygiene audits, as an example, you might be able to see that there's a rise in infections or that staff are missing certain steps in that hand hygiene process. So, doing a root cause analysis, chartering a PIP, looking for areas of quality improvement that you can take back for QAPI. Using all of these tools that you've been tracking daily and weekly and now monthly to use for improvement. Do you have any adverse drug events, as an example, or were there delays in lab draws and the results? These kinds of things should be monitored on a regular basis. And again, if you're identifying some of these issues, doing a root cause analysis, chartering a PIP with your team can help with that quality improvement piece and work on QAPI. Next slide, please. As with all aspects of quality care and infection prevention, there's always effective communication, and that is what is essential. A successful IP makes sure that the necessary information is communicated timely to those who need to know. That includes the residents, families, staff, your providers, and when indicated, your local and state health departments. Knowing what, who, and how it will be reported and shared can make the difference between a widespread versus a well-contained outbreak. It also is going to promote confidence in the facility when everyone involved is kept informed. So before we move on, I just want you to think about even updated guidance that we get. How is that updated guidance communicated to your staff? How do you communicate that? How do you communicate residents who are at high risk for infection to your staff? Looking at labs, how do those labs come to you? And how are antibiotics communicated to you? Just some things to think about in that communication piece. Next slide, please. So what does that communication look like after hours? After hours, I mean overnight, on weekends. When you look at these after hours examples, think about your staff And if they have been trained on any of the above processes and they know the expectations while working on a weekend or after hours, or if you're not there for some reason. How are you being notified if there's an infection control issue or an outbreak that's been identified? Does your staff have your number? And does the facility have a phone tree? Do you have access to EHR outside the facility? And do you need access to EHR outside of the facility? Do staff have access to the medical director, primary care physicians, practitioners, pharmacy, lab after hours? Are you notified if someone is transferred to the hospital, whether it's infection control related or not? Or maybe someone develops a wound and it's on a weekend. Are you notified of that? You may not be the wound nurse, but that wound could become infected. So being in the know of everything with the wounds is extremely important as well. You know, many facilities, they have an on-call rotation, right? With the nurse managers, and they should be considered also. You know, do they know what to do if they're on call and there's an infection control issue or possibly a COVID positive? What does that communication piece look like? Do you know, do they know to call you? Do they call the DON? Do they call the administrator? Think about that communication piece because all of your managers need to be a part of that as well. Be proactive, plan ahead, and think about those things that could happen or that need to be addressed when you are not there, and help ensure that you have a strong system in place to communicate that to your staff, the other managers, and to leadership. Next slide, please. So we touched upon this in part 1, but I want to talk about it a little bit more. So how do you decide what you're going to do daily, weekly, monthly, and annually? I'm going to share just a few different ways that you can help stay organized. So spreadsheets is one of them. And what you can do is you can have a tab for your daily duties, a tab for your weekly duties, and one for your monthly duties. You can use that spreadsheet as a working document throughout the day. You can add things to it, and as new things come up, you can add to that to ensure that you get them done throughout the day. You can add to your weekly and monthly, and even add an annuals tab. And because as you get going in your role, there may be new duties that may be delegated to you, or just as a reminder to complete them. You can also share this spreadsheet with your DON, your administrator, your whole nurse management team. We all know as an IP that there are many, many things that you are responsible for. So sharing that spreadsheet with them, it's not only going to keep them astute of what you're doing as it relates to infection prevention and control, but it lets them know if you're super busy or working on something specific, and they may have something to add to what you're working on that they've noticed on your spreadsheet, that maybe they can bring some data, maybe they can bring some insight to help you with what you're doing during the day. Your MDS person would be a great person to share that with, since you communicate with that MDS person when it relates to infections. Admins, I just want to mention, admins and DONs should always be kept in the know of what your infection control rates are, how many immunizations you've done, clinics that are set up, etc. COVID, what are your outbreaks for the month? What COVID education are you doing for the month? What proactive measures are you working on? Another way to stay organized is to create a very simple checklist. And this can be a template checklist. This can be one that you print the same thing over and over, and then you can add to it. Creating a weekly and a monthly checklist can help you as a reminder of what to do on a certain day of every week, or what to do at the end of the month. For me personally, as a DON, I used to always use a combination of a checklist and a calendar. So for me, a calendar, it can help organize your tasks in a different way. Like, for example, I'm going to do infection control trainings on Tuesdays. I'm going to do all things immunizations on Fridays, and I'm going to do antibiotic data extraction on Thursdays. This style of organization is going to allow you to structure categories and also help other managers know what you do when. And it can be beneficial when setting up future meetings or reports and planning ahead. But you're always going to have fires to put out, and you're always going to have emergencies that come up. But ensuring that you have some type of a structured system in place is going to help you be able to jump back in when time allows. So just remember, as we go through all of these different organization strategies, I just want you to remember, infection prevention and control does not stop if you are out sick, as you guys probably know. Someone needs to continue that work. And as we mentioned in our part one session, having a backup person is important, and it's something that you should at least consider. If you're out and then that person should know some of your role, right? For example, they should know how to track antibiotics, put them on the log. They should know how to identify any new admission that comes in and look if they're at risk for infection. Know your immunization program, your vaccinations, who's due, that type of thing. So if you're unexpectedly out sick or something else happens that's unplanned and you have to leave, you need to be able to delegate those tasks and those duties. So having some type of organized structure like a spreadsheet or the checklist or the calendar is going to assist that person in knowing what is done and what still needs to be done. I know at the end of my day, what I always did is I printed my checklist in my calendar, and I kind of reviewed it, and it kind of gave me an idea in that mental mode of what my day is going to look like the next day. And I could come in prepared. Now, with that being said, I do know that many times you get hit with calls and staffing issues even before you walk through the door, right? But that does not have to throw off your entire day. Put the fires out and then grab your checklist, open your spreadsheet, and get going on the original planned day. The key is just ensuring that you have some type of system in place, because organizing yourself each day is what's going to help you be a successful infection preventionist in your facility. Next slide, please. So I've provided a slide here with some additional resources for you that may be helpful to you in your role. So when you get this presentation, be sure to check these links out because there's a lot of really good, useful information in there. Next slide, please. So before we continue on, I want to stop and ask if anybody has any questions. You can come off of mute. You can put it in chat, and Ro will let me know if there's any questions before we move on. Are you seeing anything, Ro?
Nothing in chat.
Okay, next slide, please. So before we close today, at the end of our session, there's going to be a 5-question survey that is going to pop up. It is anonymous, and I strongly encourage you to take just a minute or two to answer the questions. Your feedback from this session helps us know how we're doing and where we can improve and help to meet you guys where you're at. So be sure to stick around. It just takes a minute for you to complete that for us. And don't miss our upcoming sessions. January 14th is NHSN office hours. Thursday, January 16th is long-term care guidance, enhancing quality and oversight, revisions you should know. And finally, on Tuesday, January 21st, holistic approaches to COVID-19, a focus on dementia care. And with
Carrie,
that, yes,
I'm so sorry. We have something in chat.
yes.
There's a question. How do you organize your spreadsheet for the day?
You can actually just list out if there are standard things that you know that you do every day and it's rounds, it's morning meeting, it's all of that. You can list all of those out in all of the columns. And it's basically a list of everything that you're going to tackle that day. And then off in one of the other boxes, you can exit off. You could have a section for notes. If it's something that you've seen something on rounds, you have rounds on your list, but that you've seen something on there and you need to go back and you're going to have to follow up on that, you can make notes on that spreadsheet. That's something I always used to like to do. Instead of having post-it notes and papers all around me, that spreadsheet helped me keep all of my notes organized on that spreadsheet. So thank you for that question. Next slide, please. If no one has anything else, as a reminder, please fill out that post-event assessment. Once the session ends, it's going to pop up. And I just want to thank everybody for joining us today and participating in our chat and sharing in our Mentimeter questions. We appreciate all that you do each day to keep your residents safe and healthy. Thank you so much.